Hello everyone, welcome back to my channel. My name is Dr. Tiffany, chiropractor and holistic health and life coach. Today I would like to have a conversation with my colleagues. This is not an easy conversation to have by any means, but at this point it's definitely necessary. So if you're a doctor, a healthcare professional, even a nurse practitioner, a dentist, or anybody who has the ability to diagnose and treat within your field, this video is for you. And I would like to start by asking you, why do you wake up every day and do what you do? Are you motivated by outside influences, or are you motivated by a desire to really want to help your patients get better? Are you focusing on healing, or are you focusing on disease management? And when I speak of healing and disease management, those are two totally different things. Are you focused on treating the entire patient and wanting the patient to heal from the inside out and improve their overall wellness and quality of life? Or are you treating their symptoms and managing their diseases, and in a sense having them or expecting them to understand that this is the end all be all, right? With regard to you as a person overall, are you living morally upright, or are you living hypocritically? Because that also affects how you show up, not only to work every day, but also in the world, right? And we know that right now, in this day and time, the healthcare profession overall is in trouble. But that is not the end. We as professionals have a job to do, right? You made a promise to do no harm in whichever area of expertise you decided to choose. So if you made a promise to do no harm, that means that you want the best for your patients. When you wake up every morning and you go to work, are you putting your best foot forward? Are you providing your patients with accurate information? Are you motivated by outside influences, or are you willing to do whatever it takes to help that patient heal? This is a tough conversation because a lot of doctors and professionals are now motivated by money. They're motivated, or you're motivated, and I'm saying you because I am not. You're motivated by the kickbacks, right? And whatever other source of income that may become available to you due to you practicing a certain way. So if you are practicing that way, I challenge you to ask yourself, are you pleasing yourself and man, or are you pleasing God? Because if you made a promise and you took an oath, then you are responsible for that commitment that you made. And at some point, when you leave this earth, you're going to have to answer to God. We are sometimes easily motivated by monetary gain, but what does it profit you to gain the whole world and lose your soul? And on top of that, lead your patients astray and keep them in a state of bondage. Because the truth of the matter is, their blood is on your hands. Yes, you have malpractice insurance, but malpractice insurance doesn't work with God. you're going to have to answer for everything that you're doing. So today I want to challenge you to evaluate where you're operating from, evaluate your motives, and do some deep introspection, because we are responsible for the health and well-being of our population. And if over half or majority of our population is unhealthy and they are suffering from disease, then we have to take a look at what we are and are not doing and commit to changing for the better. Yes, each person is responsible for their own health and well-being, but you, as a doctor, as the expert, have a responsibility when you are taking care of your patients. They're looking to you for advice, right? They trust your judgment because of your level of expertise. So if you are leading them astray, you're responsible, period. I encourage you to put your patients first. Remove your desires and think about what's best for your patients moving forward and commit to doing so. Until next time, heal holistically, and I look forward to speaking with you soon. Bye.